Hi, good morning all. Today I am going to present the topic safe lifting and handling of patients. So what is a safe patient handling? A policy and practice that creates a safe work environment for patients and healthcare workers by eliminating hazardous manual lifting tasks. Transferring and repositioning patient is accomplished by using new technologies such as mechanical lift and repositioning devices. Positioning and transfers. Positioning. If the patient is lying on a back, place a pillow under the head, under affected shoulder, elbow, forearm, wrist, and hand. Ensure feet are in a neutral position. If the patient is lying on an unaffected side, place a pillow under the head. Place the affected shoulder forward, scapula protected with the arm and hand supported on pillow. The affected leg is entirely supported by pillows. Hip and knees are bent. A pillow behind back can prevent rolling backward. If the patient is lying on affected side, use this position only if it does not affect breathing. Place a pillow under the head. Place affected shoulder forward. Extend the wrist and finger. Affected leg should be straight with the knee. Slightly bend, place unaffected leg on a pillow for support. If the patient is sitting position on a chair, sit well back in the center of the chair or wheelchair. Place the arms well forward, feet flat on floor or footrest, the knees directly above the feet. The patient sitting on a bed, sit upright, up and well, supported by pillows. Place both arms on pillows, legs supported for comfort. So the patient is going to transfer means roll the patient on one side, then move the patient to the side of the bed. Ask the patient to bend legs and to proper on the same side elbow. Then hold your hand on the patient pelvis as to raise him over the buttocks. Sit patient on the edge of the bed with the feet flat on the floor. Then stand in front of the patient and hold both shoulders. Keep patient feet flat on the floor. Then help patient raise bottom from the head and rotate him or her towards the chair. Then transfer from bed to chair, hold patient by shoulders and knee. This is the do's and don'ts in the positioning. Then first you prepare your environment. Make sure your weight is at the opposite side of the body that has to be repositioned. Make sure all appliances and devices are placed properly, locked and in proper height before proceeding. Bend your knees slightly but maintain your natural spine curve. Avoid stooping by bending slightly at the hips. And keep your elbows tucked in and out. Avoid reaching further away from the body, whereas the load is greater and the potential for harm is more. And tighten abdominal muscles. Tighten your abdominal muscles to support and your spine and reduce stress on your back. Then head up. Keep your head raised with your chin tucked in during the movements. Then move smoothly throughout the techniques and avoid twisting or jerky movements. Then prepare your environment. Position the equipments and assistive devices correctly. Check route and access ways are clear and the destination is safe. Always be aware of and remove any hazards that may hinder you to transfer yourself properly. Make sure all appliances and devices are placed properly, locked and in proper height before proceeding. Then try to know your limits. If you think you are not capable of transferring yourself, always ask for assistance from your caregiver or any household members present in your house. Try to avoid going straight to his sitting or standing position after lying straight on your back. This might cause slight headache or dizziness and could result in a fall. Use your strong side first, followed by your weak side in leading your transfer. This will promote continuity and fluidity of your movement patterns and hence avoid twisting or jerky movements. In case of a fall, try not to panic. If there is no one to help you up, try to look for the nearest appliances or devices you can use to get up. First, roll to your side, assume the prone on the all four positions, and start to crawl yourself towards the appliances or devices and slowly help yourself up until you reach a stable position. And things to remember when you transfer the patient. Proper positioning can be useful to minimize or prevent pain and stiffness that are commonly present post-stroke. It can also help to regain movement that was lost after your stroke or limit future problems with the movement. Careful positioning and placement of pillows may increase comfort and safety. The bed must be the correct height to promote independence and safety for the patient, family, and healthcare workers. Position should be arranged every 2 to 4 hours to prevent skin breakdown and improve comfort. These are the patient transfer boards, and this is the patient sliding sheet. Thank you so much.